to create a larger opening. It's painful, very long recovery, and I've had patients come back after that and their sleep apnea isn't resolved. So it's not 100%. Even if it does resolve it, it's usually maybe 5 years, and then you're gonna have sleep apnea again. So.
Is that because the tissue goes back?
Yeah, and then the tissue will get swollen and start obstructing again.
Scar tissue.
Yeah, probably.
Heavier, right?
Yeah.
So here's the restless leg syndrome. It's very unpleasant. Tingling, creepy feeling, nervousness in your legs, and it's when you're sitting or when you're about to fall asleep. It's usually right in the beginning of your night. 12 million people suffer from this, and it could be a neurological. A lot of people from neurology come, and we have a neurological sleep doc that works in our sleep center. You don't necessarily need a sleep study for this. It just has to be symptoms that the doctor, you tell the doctor how you're feeling, and if he thinks that this is restless leg syndrome, there's medication for it.
Yeah, and the issue with this as a sleep tech, I've seen a lot of patients that have restless leg, and it translates into the nighttime, into the sleep. So even when you're sleeping, you see the patient's legs jerk regularly. Looks like they're running. I've had some that are so severe, it really looks like they are running in bed. And it happens very regularly. You get, 600 to 900 leg movements a night, and some of them can wake patients up. So that's where that comes into play as far as a sleep disorder.
Yeah. I remember seeing a video where a guy had a baseball bat and was hitting his leg while he was sleeping. Did you see that? Yeah, that was his restless leg. It's not good. I had it once when I was in an airplane, and that was awful. You're in a small place and you can't move your legs. Oh, it's awful. Narcolepsy. Narcolepsy is very rare. Narcolepsy is when you have people that just drop. And it's involuntary. They have excessive daytime sleepiness. They have a loss of muscle tone, and it usually, ironically, happens when they're emotional. So if you make them laugh, scare them, anything that would take them out of their norm is an involuntary, it causes them to drop if they have narcolepsy.
Like those little goats that you see.
They do have those.
Goats.
Jennifer has
And they
those.
fainting.
Narcoleptic ghosts.
Yeah, they do have them. Our friend at work has 2 of them.
Yeah. And,
Yeah.
and you scare them and they literally
Drop.
fall over.
Yeah, they
And
drop.
then a couple of minutes later they get back up and go along their merry way.
Yeah, and some people with narcolepsy, they also can be they can be looking at you and they can't move. And they can't move any of their muscles. So it's a very interesting sleep disorder. And 1 in 2,000 people have this. It's very rare, and it's usually diagnosed when they're older.
Yeah, we actually had a doc, one of our sleep docs, when I first started, Dr. Jack. I don't know if you ever worked with him,
Yeah.
but he was narcoleptic. So he would actually go take naps in between every one of his patients. He'd come out of the room and go into one of the bedrooms, because we were at the sleep lab, take a nap, 15 minutes, get up and see his next patient. So yeah, he was truly narcoleptic. And
Yeah.
So,
And that is neurological as
what a
well.
perfect job for him, right?
Yeah, I know.
Exactly.
That probably is what got him started, I'm
Yeah.
sure, because narcolepsy is pretty, I mean, I actually met a guy online through our sleep networks, and he was a narcoleptic, and at work, he had to always have someone with him. He could never swim, so he can never go in water by himself, or even with people, he could never go in water, he
And they
said.
can't drive.
And you can't drive. Yeah, it's pretty serious. So, yeah, it's pretty interesting.
So is it up to the sleep doctor to report it to the
Yes.
DMV?
Yeah.
And usually the treatment for it is medications like Provigil, Ritalin,
Some
Adderall, yeah, stimulating medications.
Yeah. Word about napping. Is napping helpful?
don't know, it sure feels good though.
It sure does. How many nap and feel like they didn't get a good quality nap? You? How long are you napping for?
Oh, it depends. I mean, if I am off work and I'm just really tired, I mean, I might lay down for, an hour or more. Sometimes if I'm just really tired, but I've got lots to do, it may just be like 20 minutes or.
Mm-hmm. Our sleep docs tell us that a 15-minute to 20-minute nap is what you should be doing. If you do anything longer, you end up in your deeper sleeps. And that's what I was trying to look for. If you're on an hour,
Right.
you feel heavier.
Yes.
You feel like you've been, like you need more sleep.
Mhm.
It's probably because you ended up in a deeper sleep. Yeah.
So should you be setting an alarm? Because
Yes.
I'm just, like,
Yeah.
go to take a nap and 2 hours later I get up and
Right.
I'm just like, can't even function.
Yeah, and I have never done a 15-minute nap that I can remember in my lifetime because I like the hour
Right.
to sleep. And I'm a bad example, but my husband's a really good example. He takes a nap on
my
his
dad
lunch
does too.
and he loves it. He does 15 minutes and loves it. And he does have sleep apnea and he just has not been diagnosed with it. I know this, I hear it. So it does help, it does. What time of the day is best? I think it's really up to your sleep cycle, where you're sleeping, and what time of the day it is for you. There
Is it
isn't
in the
really
middle of
anything
your cycle,
specific
though?
that you know of, huh? Huh?
The nap time, should it be like right in the middle of your cycle?
It should be, yeah. Yeah. What are the benefits?
For me, I would get crabby if I take a nap.
You'd be crabby if you take a nap?
Yeah, I don't take naps.
Yeah.
So,
It just restores your energy, just like sleep would. If you're using the CPAP machine, we recommend that you sleep with that machine on your naps. Because if you have sleep apnea, your naps are not quality either. So you want them to be quality.
We have a patient that sleeps in his recliner in the daytime, so he moved his old machine downstairs.
Yeah. That's a good idea.
Really?
So it's not happening with him.
It's nice.
Yeah.
How we diagnose sleep apnea, I'm moving a couple slides ahead to just get us done a little faster here for you guys. Diagnosing, we do it on a polysomnograph. It measures brain waves, so we know when you're sleeping. It measures the heart rate, because we want to just measure your heart rate. We want it to be regular. We also do body movements, because there could be parasomnias, which we did not discuss, which is like sleepwalking, sleep talking, and REM sleep disorder is also a movement disorder that people are acting out their dreams. MSLT is a study that we test for narcolepsy. So we would have a patient come into our lab for a whole 22 hours. They do a night sleep test, which is the polysomnogram, where we measure all that. We measure your breathing. And then in the morning, we do a series of 5 naps, 2 hours apart. And we're doing it for only 25 minutes to see how fast the person falls asleep when we lay them down and when they hit their REM sleep, and if they do hit their REM sleep. Out of those 5 naps, if they hit REM sleep twice, they could be, that is a positive sign for narcolepsy. Treatment, behavioral therapy, medications, device appliances like we talked about in surgery. So sleep tips. Avoid alcohol and caffeine. We really tell people to avoid caffeine after noon. That's kind of our rule, isn't it? I don't follow that rule necessarily that good, but that is the rule. Alcohol and nicotine do affect sleep apnea. So those of you who like to have a glass of wine before bed may work for you. It also may harm you. Exercise, but not close to bedtime. Exercise in the morning is the best time. I am not one to tell you when to exercise, but that's when our doctors tell us the best time is. And avoid naps. Interesting. Sleep tips. We've already talked about this a little bit, so engaging and relaxing. Don't do anything really activity before bedtime, so nice bath. Try to stay away from the TV, read a book maybe, drink some chamomile tea. You don't want to drink and eat too much before bedtime. And try to be in a cool, comfortable sleep environment.
Is darker better?
Yes. Actually, as dark sheets are better than white sheets. Yeah. I don't really know. I don't have a study, but just through experience, I've heard dark sheets versus the white. People that have a lot of daytime sleepiness, we sometimes tell them that we would like them to do a diary of their sleep so we know how their day is going and see if we can adjust anything. And we all know that sleep deprivation causes problems. Does anybody have any questions?
Back in the beginning, the different stages, 1, 2, 3, and then REM, you had said something about 25% in REM.
Yeah.
That's what the average person spends a night in that stage of sleep.
25%. What about the
25%
other
of the
3 stages?
For the most part, stage 2 is probably 50 or more % of the night.
Yeah.
Okay, so 50% and then the other 2.
Yeah, it's about, this is kind of, it's about 5 to 7% stage 1, 50% stage 2.
And what stage is the deep sleep? Stage
3.
Yeah, so I think it's about 15%.
And what about somebody with narcolepsy?
They're way off the chart in REM, or like they're stage 3. There's minimal interruption.
They hit stage 3 quicker?
They hit REM quicker.
Or-
Yeah, they jump into REM. They can jump into REM in 5 minutes.
So, when, I'm not sure if I've seen this or I've just heard others talk about this, but I used to work with a guy who he'd fall asleep on the couch and his girlfriend would see the REM sleep
Mm-hmm.
in his naps. She'd see the eyes moving. Is that,
So, rapid eye movement is what we see when people are in their deep sleep. There are people that do move their eyes in their sleep throughout the whole night. It's rare, and it's usually caused by a medication,
Usually antidepressants.
antidepressants.
We call it Prozac eyes.
Yeah.
So you'll see them start to fall asleep and their eyes are just rolling the whole time. But then again, I mean, patients can hit REM really fast. It's not only because of narcolepsy. Like, for personal experience, when I worked nights, I would switch my schedule back and forth. So when I wasn't working, I was up during the day. When I was working, I was up during the night. Really messed me up. So on my last night, when I got off in the morning, I would try to stay up as long as I could. And so by the time I went to bed, I was so sleep deprived that when I closed my eyes, there were periods of time, and it didn't happen often, but I would dream right away because I was so sleep deprived. So it could be sleep deprivation as well, causing, quick REM cycles when you go to sleep.
What if you wake up in the morning and you go to sleep and wake up in the morning and you can dream, change your dream, same dream?
I like when that happens, if it's a good
But I
dream.
can do it for 7 or 8 times. I hit my snooze button. My snooze button 7 or 12 minutes.
That's nice.
But how do you get into REM sleep that fast?
You-
only dream in REM.
I can only say this from watching people as a sleep tech. We see people going in and out of REM sleep, like out of a 10-minute frame.
As long as the interruption is short,
Yeah.
then all you're doing is hitting that and going right back to sleep.
Yeah.
I've had patients that they
So I'm not coming
wake
out of
up
it.
and then the very next minute they're back into REM because that's where you were. Quick interruption, go back into REM.
Yeah.
Plus your longest stage of REM is in the morning.
Yeah. Your longest stage of REM is going to be in the early morning hours. Yeah.
Do you guys see many kids with narcolepsy?
We don't.
Our sleep lab doesn't see, I think our youngest we can take is 14 or 15. We don't,
So you
I've done,
basically just see adults.
yeah, I've done sleep studies and MSLTs on kids, and usually it's just their sleep disorder is just them being a pre-adolescent kid. And
Yeah.
they want to stay up all night, they want to sleep all day, and that's usually what we see.
A lot of schools, ironically, are changing their start times for high schools, and it is based around their sleep pattern. They like to go to bed later and they like to wake up later. And
I mean, I did
Yeah.
sleep studies for 10 years, and I can probably count on one hand how many MSLTs I ran that showed possible narcolepsy. So it's very, very, very rare.
So, does it, when you wake up in the morning, you feel all refreshed? Is it have everything to do with how many hours of sleep you got, or does it have to do with what stage you woke up in?
it's a good question.
I think it could be a combination of both.
Yeah.
Because when you wake up out of the stage 3, you're in such a deep, dead sleep. If you wake up out of that, you do feel
Groggy.
Yeah.
So I think
So
it's a
when you wake
combination of
up,
both
does
of
the
them.
cycle go, like if you go naturally,
In the normal adult,
you go
they'll
1,
cycle
2,
out,
3,
yeah.
4, and
Here,
then
let me
3,
move
2,
to-
1,
Yeah.
you cycle back.
Well, usually the cycle will go, usually at the end of the night, patients are in stage 2. Because the stage 2 is going to take up the most of the night, and usually patients will cycle through into stage REM. They'll wake up, start in stage 1, cycle to a REM. I think you have maybe 2 or 3 REM cycles a night, and then you're in stage 2 for the last part of the night, and then you wake up.
Yeah. This one shows 8 hours. As sleep techs, we only see 6 hours, so she's right. We only see about 2 or 3 REM cycles on a normal person. And when I say normal, I mean that doesn't have sleep apnea. Because people with sleep apnea, sometimes we never see REM. And then we put them on the mask, put them on the CPAP, and then they jump right into REM. Because they've never,
They've never.
they're not used to it. Their bodies are like in
Slept.
shock.
They've
And
never
we've
slept.
even had patients wake up going, I don't know what you did, but it was good.
I
You know?
have many after they come back after their sleep studies. That's the best night I've ever slept. ever.
Yeah. They want to take the
And they
CPAP
only
home.
have
Yeah.
for part of the night.
They're convinced we did something to the air. It's just room air. Yeah.
How often does their CPAP not help them?
Depends on the patient. It is really easy for some to pick up, and it's really difficult for others. And really, most of the time, it's regarding the mask.
Some patients have a harder time acclimating to it than
Yeah.
others. Some will take to it and wear it every night and love it. And some patients, they'll fight with the mask, they won't wear it as often as they should. And it's just trying to get through that fight, and then they'll start to do better.
What we generally try to do when people are fighting us on wearing the mask is we just try to tell them, baby steps. 3 hours tonight, you rip it off, okay, that's okay, let's try again tomorrow.
When you're watching TV, get used to it.
Yeah. Or we tell them, come back, that's not gonna work, we wanna find another one. Because, like I said, I think we have a nasal pillow mask that goes into your nostrils. We have one that look like that one that goes over the nose, and then we have one that goes over the mouth and nose. Yeah, for the mouth breathers.
So I toss and turn a lot. I mean, even before I fall asleep and then all through the night, my husband tells me I toss and turn a lot. But how do people like that do a CPAP? Or does the CPAP help them breathe enough and they don't toss and turn anymore?
So, when you're tossing and turning, it could be sleep apnea. Your airways being cut off, okay? So, you're fight or flight, you're waking up, and you gotta go back into your stage of sleep, whatever you're continuing in. When you put the mask on and you're breathing with the mask, that airway, consider it a crutch. It's keeping your air airway open so you can breathe normally. That's what I tell the patients is that air is like a fan. It's keeping that airway open so you can just breathe normally. So when you're breathing normally, you have nothing waking you up most of the time, unless you're in pain. Pain is another thing that keeps us up at night.
Yeah, it really depends on why you're tossing and turning.
I
Yeah.
was gonna say, they have masks now so that the coats sit on the front of your face, it's actually on the top of your head. So you can
Okay,
turn
so
it
like I'm a
side to
tummy
side.
sleeper.
A tummy, you're a tummy sleeper? And you know, some people that sleep on their stomach do really well because your tongue, sometimes your tongue falls back. And if you're laying on your stomach, you're causing your jaw to be forward and your tongue to be forward so that airway stays open more. People that sleep on their back, it's harder because it's gravity, thank you.
Yeah, usually with patients, the most severe that we'll see them during a sleep study is on their back and in REM. Those are the two times when sleep apnea will be at its most severe. And we get a lot of surgical referrals because when a patient, goes under general anesthesia or they're going to be on narcotic pain medication, those things can make sleep apnea worse or create sleep apnea in a patient that doesn't normally have sleep apnea. So they'll be screened by the anesthesiologist. They'll come to our clinic, do a sleep study, get on CPAP, have the surgery, and if it's just because of the medications or the anesthesia, then they'll be able to get off of it, or maybe it's just a diagnosis they never knew they had until they went to have surgery, and they'll be on CPAP. But a lot of our referrals come from surgical.
Or a stay in the hospital where they
Yeah.
had oxygen on their finger all night long.
And no one knew, they didn't know they had sleep apnea until they.
I like the ones that said, my wife makes me come in here.
How are you here today?
Those are my favorite patients, I miss them. But, any other questions? Well, thank you for letting us do this presentation. Thank you, Christy, for asking us to come.
You guys.